Greetings, everyone, and thank you for joining today's webinar, How Local Health Departments Are Driving Data Innovation. We'll get started in a moment. Hi again, everyone. My name is Jenny Bankston, and I am the manager of Affiliate Business Partner Membership at NACCHO, the National Association of County and City Health Officials. Before we begin, a few housekeeping notes. This webinar is being recorded.
Jenny,
Yes.
I'm just going to stop you because I'm having a hard time hearing you. I don't know if the other participants are or not.
Okay, I will try to speak up. Let's start again. Hi, everyone. My name is Jenny Bankston, and I am the manager of Affiliate Business Partners at Partnerships at NACCHO, the National Association of County and City Health Officials. Before we begin, a few housekeeping items. This webinar is being recorded and will be available to all registrants with a slide deck by the end of the week. If you are watching live, we encourage you to join into the conversation. Let us know you are here in the comments section and type any questions you have using the Q&A function. We'll try to get as many questions in as possible at the end of the session. That said, your participation is encouraged throughout. So if you do have a question during the presentation, please raise your hand. Today's session is being brought to you by NACCHO's Diamond Affiliate Business Partner member, Metopio. Metopio helps public health professionals nationwide same time simplify processes and uncover insights by making data easier to access, analyze, and use. NACCHO and Metopio have partnered to help local health departments strengthen how they use data for the community for community health planning and decision making. Through this collaboration, NACCHO members have exclusive benefits to gain access to a powerful platform that provides curated public health data, insights, and automation that makes it easier to move from data to action in their communities. So without further ado, I'd like to introduce our speakers. Angie Grover. Angie is the Chief Operating Officer and co-founder of Metopio. She brings more than 30 years of leadership experience at the intersection of healthcare, government, technology, and public policy, where she has worked across the country to address complex healthcare challenges from healthcare delivery and payment models to social determinants of health like food insecurity, housing, and behavioral health. She's passionate about helping communities harness data to drive smarter decisions, stronger partnerships, and healthier outcomes. Angie holds a bachelor's degree in political science from Drake University and a master of business creation from the University of Utah. Erica Bird. Erica serves as the Deputy Director for Madison County Public Health, where she supports the planning and administration of over 30 public health programs. She also leads the county's community health assessment and improvement plan processes. Erica holds a master's of public health from SUNY Upstate Medical University and Syracuse University, along with a bachelor's degree in global health studies from Allegheny College. Her background includes roles in data analysis, quality improvement, and community engagement, with a focus on data-driven and community-informed approaches to guide public health in action. Thank you again for joining. Let's get started. Angie, over to you.
Okay. I'm telling you, the full moon has made everything bonkers. So I appreciate your patience as we get through this. So thank you, Jenny. We're not only proud to partner with NACCHO, but one of the best parts of my job is getting to work with really talented and committed individuals like Erica. And we both chose maroon today, so we're kind of twinning on screen. I'm really appreciative that she's taken time to reflect on her processes over the last 3 cycles and has joined us here today. So, what we really want you to be able to take away from our conversation that we'll have with you today is, how to design smarter data. And if you don't have to be a data scientist to do it, really, this is about your data and some infrastructure to help make that work together to reach your goals. How to increase collaboration and decrease duplication in your community and build that capacity to achieve all the health outcomes we want to see in our communities. And finally, how to leverage all this information you're gathering and creating to maximize your workflows, improve reporting, and really create sustainable processes that build value over time. So, as I said, Eric and I are going to have a conversation where she will share her journey and how it's evolved over time. We encourage you to type questions in the chat, and as they come up, we'll try and address them. I'll try and weave them in as best I can, but we'll definitely have some time at the end to answer as many as possible. But what I really want to do is get started by learning a little bit about Madison County. Erica, can you tell us about the community that you serve?
Absolutely. And thank you, NACCHO and Metopio, for inviting me to be here today. So Madison County is in central New York. We are largely rural. We serve a population of about 68,000 people. We do have two urban hubs in our neighboring counties, Syracuse and Utica, for those of you familiar. But we are rural with a little suburb sprinkled in there. Now, we have a few key populations like many rural communities. We have an aging adult population. We do have a large agricultural community, which includes migrant farmers and Amish families. We do have a Native American population, and of course, the low-income residents in our community, which tend to be the most isolated. And of course, rural means the lack of public resources, such as transportation. A couple other things that make us unique. We have two independent hospital systems, and to date, they have not been bought out. So that's relatively unique. And then we also have two academic institutions, a state school as well as Colgate University. We have a team of 38 amazing staff who oversee 30 programs. So we're lean and mean, but we work very closely with some of our partner agencies, including county departments like mental health and social services, and then a lot of nonprofits like Cornell Cooperative Extension, Office for the Aging, just to name a few.
And having grown up in a small town, Erica, I feel like it sounds perfect. We know that about 35% of the local health districts look a lot like Madison County. And at Metopio, we're fortunate to work with health departments that are much smaller. I think our smallest one is 5,000, and ones like Contra Costa in California that serve more than 1 million people. So no matter what size the department is, I think you and I can agree that the needs for data and insights are the same. You may apply them a little different based on your staffing and capacity, but you still need data to drive decisions. And what I think is particularly interesting is that you've been through 3 cycles with Madison County, and not everyone can say that. And you really did it during a time of a lot of disruption and change. So, I would really like you to continue your narrative and tell us a little bit about your journey at Madison County Public Health.
Absolutely. So I started in 2019 with the county. And at the time, one of my colleagues was facilitating the process. They had chosen to use MAP. My main responsibility was the health status assessment, pulling all the secondary data together. I also was responsible for all the qualitative data from the 8 focus groups we did that year to the local public health systems assessment and forces of change assessment. So easily 6 months of full-time data analysis, data collection, just drowning in spreadsheets. Even highlighting thematic analysis. And then, of course, writing all of those reports up by hand before we actually got to the full CHA and CHIP. So the only saving grace that year, I would say, was our hospital systems did fund a community survey where they hired a company to conduct the survey and do the analysis. But you can expect that we were very burnt out by the time it got to the CHIP phase. And then fast forward, so 2022 comes in, and for those of you working in public health at the time, you remember that local public health agencies were still 1 foot in pandemic response and 1 foot in regular programming. So we did receive a waiver from our state health department to do an abbreviated version. So that looked like, at least for us, we didn't do any primary data collection. We relied on our 2019 primary data, but still did all the same secondary data analysis to see what our benchmarks looked like. And I did get a little wiser this cycle. I had an intern with me, but she and I still spent about 6 months doing that data analysis, trying to pull everything together. And so we still had that same burnout. By the time we got to the strategy conversations, we had lost a little momentum. So then fast forward again, 2025. So I really wanted to approach this cycle differently. So 2022, I forgot to mention, but I did lead that cycle for the first time. Again, in 2025, I was looking to facilitate and I wanted to do a couple things different. The first was bring more partners to the table right off the bat. So instead of having steering committees of just our health department and the hospitals, I really wanted to have that nonprofit voice present at that conversation. Um, as we know, partners do a lot of the work in these projects, so having them part of that methodology was going to be important. The other thing is I did want to persuade them to use a neutral facilitator because I wanted to be able to be a participant in the meetings moving forward. And then lastly, I wanted to handle the data better so that we had more time and energy to focus on that chip phase. So back in November of 2024, I pulled together 10 agencies and we determined the methodology together. It was at that meeting that I pitched Metopio, and it really changed the trajectory of this cycle for us. So I'm excited to kind of dig into the next steps.
Yeah, innovation really involves improving and replacing and rethinking those existing processes, products, and partnerships to increase efficiency. And I really think Madison County has shown the ability to grow over the course of time. And it's been great that you've been a constant in that process. For the next part of our conversation, we're going to do a bit of show and tell. So we've broken down some of the key considerations for all of you that have joined us here today, and we're going to put them in the context of Erica's lived experience. So I'm fairly certain that everyone on the call can or has taken at least one of the steps we'll discuss, but I think we would agree that you could take all of them. So Erica, why don't we back up and get started with how you brought everybody together?
Absolutely. So, yep, as I said in November of 2024, so looking ahead to the cycle, we brought together 10 agencies to really talk about what this process looks like. What is the purpose of a community health assessment? That shared goal around aligning resources on certain priorities that we all deem an issue in our community. And then we agreed to a proposed timeline and agreed to how we were going to select those priorities. So all of those different elements in the methodology were agreed to in this meeting. When I pitched the idea of using Metopio, I did receive some buy-in at that time, but of course they wanted a demo. So we worked with Angie's team to put together a demo in December of that year. Got great positive feedback. And then it kind of laid the foundation for me to go back to our hospital partners, which historically had contributed financially to this process while the health department contributed staff capacity. And I said, look, the three of us have to do this activity. Our nonprofit partners are here for the ride. We appreciate them, but they don't have to do this. So if our three agencies could split the cost of Metopio for this first year, let's see how it goes. And it was at that time that they did agree. And we were able to sign the contract and onboard starting in February the following year.
And one of the key takeaways for today is really about collaboration. And I think the trend we've seen working across the country is where more and more public health departments and hospitals are coming together on agreed upon cycle for their assessment. Do you guys have an agreed upon cycle, and how does that work between the hospitals and the public health department?
So the state of New York for many years aligned ourselves with the hospital 3-year cycle, which was good in many respects. But as we all know, public health takes time. So this cycle, our state Department of Health chose to move us to a 6-year so that we will kind of correspond with the hospitals. So in 3 years or in 2 years at this point, we can offer support to the hospitals, but it won't be required. So a little bit longer implementation phase.
Yeah, well, and we know how long it takes for those programs to get started and see some impact. So I think that's such an important step. And I'm not sure this relationship exists in every community. I know when we've worked with local health departments, sometimes we learn that the hospitals just expect the health department to give them all the data, and that's on top of their day job. And sometimes it's more collaborative. And like you referenced, we've also seen a lot of either academic institutions or United Way is a really big player across the country. A lot of times they'll come to the table with their data and their resources. So building this relationship does provide an opportunity for not only sustainable funding, but mutual benefit. And so once everyone is at the table, we get to talk about the fun stuff, which is data. And I think how you approached assessing what was available, grounded in, I think, the FAB accreditation standards, as well as the specific requirements from the state of New York, is really important. We had a question in the Q&A about, are these reports that are generated just cookie cutter? And they're really not, because they're reflecting your framework. We have people who use, I think it's the prevention agenda in New York. We have some people using 7 vital conditions framework, still people using Healthy People 2030. So it really is, what is grounding your collaborative framework? That's what we put into the system so that you can then analyze the data and bring in the lived experience. So I know that you really did put an emphasis on that community voice and paired it with the secondary data. So I'm going to turn it back to you to really talk us through a little bit about how you approached that data conversation and assessed what was available so you can move forward together.
Absolutely. And before I lose my thought, I wanted to just say that Metopio allows you to put data into themes. So I think that you can customize it in a lot of different ways. Um, but yeah, let's start with the secondary data. So again, we agreed to use our staff capacity. So after we onboarded with Metopio, we exported a line list of the data indicators that are available through Metopio. So this is what's called a data dictionary. And we were really able to line by line look and see which national sources were being used, either what we've used in the past or find very similar indicators. And then kind of do a cross check of, okay, what else do we want to pull in? So I'm sure many of you are thinking about your local surveillance data. We also use a few of our state health indicators. So there was a few missing gaps, if you will, that we wanted to fill in. So just as a reference point, it was about 60 indicators that we uploaded into Metopio ourselves. Although I should say, with support from our customer success manager, we're working on a data request for Metopio to help us out with some of those. So it'll probably be down closer to 20. But even so, after you upload the data, and they walked us through all of this, then all of the visualizations are at your fingertips. So that was kind of the first piece of that secondary data. And then the other piece complementing the community voice. So primary data. This was a little interesting this past cycle just because we had got the ball rolling in January prior to onboarding, but we did surveys with our community members, and we also hosted focus groups. And we worked closely with the development team again to pull in the survey results in a way that was going to be compatible with the system. And then we did a mixture of summary notes and transcription. The themes are generated by the platform. And like most AI, right, it's not perfect. You still have to be the human in the loop. You're going to validate and make sure that all of the information is accurate and then approve upon it. So it really just let us have that start, a starting place instead of starting with a blank slate.
Yeah, for sure. And the Metopio team has been there and done that. We, the co-founders and our team here at Metopio have done hundreds of community health assessments, and it's really why we developed the platform in the first place, and we strive to improve it every day. So there'll always be something we can learn from our clients' experience, and I'm really proud of the work the team did to respond to your concerns, Erica, and still find a way to deliver what you needed. It wasn't like we, gave you something and walked away. We are a partner in this process. So we'll be excited to support the updates to the indicators that you mentioned. Metopio, for the most part, curates all the federal and state data as part of the value to the platform. So they're getting updated by our data team who does the, finding, curating, cleaning, validating, all the quality, so that you have updated data, not just, that 1 year snapshot, but on an ongoing basis. So every time that data is updated, it's updated in your platform and on your atlas so that you can look at those indicators and how they're changing whenever you need to, or as often as you need to.
And I should just jump in really quick and give a shout out to our customer success manager. As many of you, I'm sure, have onboarded other software or other systems. Sometimes, yeah, you are just kind of left in the dark to go through the user videos yourself. And we meet every other week with our manager, and she is amazing. She has walked us through everything. And if she's not the expert in it, she makes sure to either link back to the data or the development team.
Yeah, so I mean, it's really exciting, and we're gonna celebrate with you all as we get through this process. But I think that is, once you're onboarded, I think you can agree, Erica, though it is pretty intuitive and easy to use. It's just that extra oomph of making sure you know where you're going, right?
Absolutely.
Um, So, that data collection phase, as I was saying, the Metopio team has done so many of these reports, and it used to consume almost all of the traditional process, like a lot of it. You said you were drowning in spreadsheets. That's not really a joke. So when we think about the time and effort that goes into the collecting that data and how important it is, it's just one piece of the puzzle. So, you spend a lot of time just getting it together. So once you have it, then you have to move into analyzing it and visualizing it. And I think, Erica, when you took time to reflect, this is really where you saw a shift in your efforts. So, kind of like this before and after, and wondering if you can just make some observations for us about, what having this kind of infrastructure helped you do.
Oh, absolutely. So yes, this is probably the best part. Um, as a data lover. So when we set up, super easy, you have your service area, you have your branding colors already logged in. They set it all up for you. And then unlike a spreadsheet where you're trying to figure out, okay, what's the best story to tell? Is it a point in time bar chart where you're just comparing? Is it a trend, longitudinal analysis? Not to mention, most of our data was not in any mapping form. So now it's at a click of a button. You're flipping through graphics. You get to pick the best insight that represents that data indicator. And then there's also some really cool tools in there like point layers. And we use this as a way to show some of our community assets. I'm just thinking off the top of my head, we had a breakdown of obesity rates by zip code. So we had a map, and then we had the visualization of one of our partner agencies does a Monday Mile program. And so we were able to pin where their Monday Miles were in relationship to those zip codes and where they might want to expand their program. But so easy to overlay the indicators and just even having every figure in your brain color, it's all consistent. The AI text caption generates for you. If you don't like the caption, you click a button and you try again. So customizable, and it just saves so much time and energy. The CHA module itself, if you aren't familiar, also has some of the report is generated. So like methodology, executive summary is generated right in the report. So again, you get to just go in and make some edits and then you're done.
Yeah. Yeah, and some of that stuff is real. Some of it, one of the questions is this just a cookie cutter? And again, I would say some of it is standard. You want to make sure you have your methodology. So we really do try and tee up those things that should be in your report, but you have complete control over what it looks like at the end of the day. And if you do something really unique and want to highlight that, that's very easy to put in there. So, I think one of the things we are seeing and at the pace of technology is, again, how does this move from all that time consuming kind of manual work to really practicing at the top of your license, using your experience and knowledge of the community to really do interpretation. I think you guys did such a great job at like digging through and finding the right visualizations for each of your indicators, because there's a million different ways you can do that, right? But you want the right one. And I think we have an example of that. One of the coolest things you all have done is you've also leveraged your ability to do these analyses and insights with your partners. So now we get to do our first bit of show and tell, which I love. So I'll pull up the next slide, and I would love if you would talk a little bit about this quick analysis that you did for your nonprofit partners.
Absolutely. So, one of our roles as local health departments is to be that resource for local data. Um, and, we've done publications in the past, adding stats to web pages, but this is going to allow us to really deep dive into analysis. So I presented at a nonprofit consortium meeting a couple months ago with this mock-up of here's what we could do with Metopio. And I focused on county demographics and housing as a high interest area. And you can see in the video just the different, this took me 10 minutes to put all this together, and it's just different images, different visualizations of the data. And one thing I wanted to note was just sharing out, Metopio has a fantastic asset called the Rural Benchmark, which, especially in any state with a massive urban center like New York City, it's really nice and a realistic comparison to say, how are we doing against like counties? Not the state, but like counties. Um, so yeah, that
Yeah.
was just one
Yeah, and
reporting.
I think, I love a good show and tell. So, you can see that this functionality is, like Erica said, she could pull this together in 10 minutes. And we're always looking for both that quality, but the efficiency as well. And so for every state, as Erica mentioned, we have pulled together a rural benchmark. I grew up in a farm town. Chicago was always in the mix when we looked at the data. And it's just really hard to see those nuances of access and disparities when you're looking at your community against, a huge metropolitan area. So, it's probably important. Well, I know it's important in every state, especially if you all are at the table in the discussions around the Rural Health Transformation Program, having that rural benchmark and being able to use the data to make the case for your community is really important. And then also just let you benchmark among your peers. So as you're creating all of these different insights, you're able to then use our AI created captions, as Erica said, we're always human in the loop, but I will also note that our AI is a closed loop AI. So it's not going out to the internet and cooking things up. It's looking at that verified, curated data we put in the platform. So it's closed loop and it's looking at the data and giving the interpretation of the data that you can then look at, edit. I like to make mine a little bit more conversational, and people read those. So it's fun to have a place to start. And then also, it really is about having these dynamic shareable insights. So, Erica, when she created this folder, can share the folder with with any of the nonprofit organizations. And that really helps them align and understand where you're focused with your efforts, how they fit in. And then they can use them in their, what we want. And, one of the questions that always comes up that we'll address is, how do I make this sustainable? Well, it's not only sustainable from a collaborative platform, but we want our efforts to be sustainable. And public health, when you look at the social determinants of health, housing is at the top of most lists these days. But how the heck are we going to work on housing, right? So let's bring in one of our collaborations in Allen County, Ohio, now has the Planning Commission at the table. Because guess what? They have dollars. And if they can show that they're actually helping not only create and meet the needs in their housing sector, but they're also contributing to a more resilient, robust community that also, plays into better health. It's like a double whammy on both sides. So that's really what we're looking at, is how do we bring those all together? Which leads us to our next conversation, which is about that infrastructure. So, we've provided you with a really great example of how that once static manual process can be really leveraged in real time with your partners. And I'd love for you to take a minute to talk about how once you finished your CHA, you moved into your CHIP, and how you envision using the new infrastructure for that work in Madison County.
Absolutely. So yeah, so we used, obviously we had put together our CHA, we used all of that to determine our priority areas, and then we were able to leverage the platform once more to use this CHIP module. And part of that is a library of evidence-based practices. So again, instead of going to multiple different sites for multiple different topic areas, it is all right there at your fingertips. So I had a staff member pull out some of those library examples based on our priority areas into a very easy document that our partners could digest. And then we had a couple brainstorming sessions, what's going to work in our community? How can we use some of those model practices and adapt to our local needs? And then, following those brainstorming meetings, we had two more to actually outline the work plan. And I say only two more because that's all it took. And which is pretty exciting. And then the CHIP module is this opportunity to compile the local strategies into any, at this point, really any format that works for your needs. So for us in New York State, our health department does require a family of measures in our submission. So the logic model format works beautifully. But if you just want a goal objective and maybe some process metrics, that is available as well. So yeah, we're now in the implementation phase. We have our work groups starting to meet, and we are excited to have some of our partners send us that data and yeah, actually watch things change over time.
And I think you took all of this to your recent FAB accreditation process, right?
Yes, actually, thank you for reminding me. So our department had submitted back in 2025. We used the 22 CHA chip. I thought it met the standards, but I wasn't necessarily the most proud of it. And we had our site visit last month, and I just raved about, the good work that we did with the CHA chip. And I had this confidence that I knew it met all of the standards for accreditation. I gave a nice shout out to Metopio that, they really helped us get through this process in a much more efficient way. So yeah, that really was an extra cherry on top.
Right. And I know it's too early to say congratulations, but we'll be excited to celebrate once you've earned that recognition. I know it's a whole lot of work. And in fact, one of the pain points we often hear from departments and collaborations across the country is by the time they're done with the chip can seem daunting. And not only just to start it, but then to track your efforts and how that all parlays into the foundational elements of the FAB accreditation processes. So since you've mentioned your chip, we're actually going to take a quick look at it. I'm going to answer one of the questions, though, real quickly from the Q&A, which is, how do you bring data? Do you connect to EHRs and things like that? So I just real quick, I know that you did the data upload process with us, and we also put your survey data in there. So uploading data into the Metopio platform right now is pretty straightforward. We do only put de-identified and aggregated data into the platform, and we did that on purpose because we do want you to use it and share it. We are a HIPAA compliant company, and I will say that a lot of times when you're working in collaboration with, your state hospital association or maybe your local hospital, sometimes we're very experienced in using claims data or utilization data. And typically what we do is we pull together, we use the AHRQ preventable hospitalizations. There's 36 of them defined by ICD-10 code. And so we can de-identify and aggregate that. And that's kind of where the magic happens. If you can see where people are going to the ED rather than, lots of that is driven by uncontrolled chronic disease or lack of access to health care and health insurance. Putting those two pieces together, I think just really gives you a deeper insight into some of the root causes in communities. So we are very well versed with all different kinds of data and can work with PHI as well as our data team is just really well versed in that de-identification and the aggregation. But I don't want to step in the way of show and tell because the chip is so cool. I'm going to let you do some of the talking about this resource. Can you tell us about the Madison County Health Atlas?
Yes, it's gorgeous. We're so proud of this. So we launched last July. Um, and again, everything is customizable. So we worked very closely with how we wanted the platform to look. And then this past January, we actually have our CHIP dashboard now. So all of our priority areas and the selected indicators that we're going to be looking at are all together in one place. And that's really powerful, I think, not only for us and our partners who are doing the work on the chip, but really our community members to see where we stand. And so right now these are baseline numbers, and we hope that over time to see some progress in the right direction.
And I think this is also a good, there's another question for us about how health atlases analyze and output local data. So the atlas is curated, and I don't know, maybe Erica, can you just talk about a little bit about selecting some indicators you want on the atlas, including your own?
Yes, absolutely. So, I would say that right off the bat, a curated list was recommended to us, which was very helpful because there are over 900 indicators in the analytics side. So it is very overwhelming. So there was the recommendation, and then we looked at what is local, what's going on in our community, and just pulled in some of their unique priority issues. And I will just add again, it's all customizable. So under the topics, we have themes that are different than the curated ones that are provided by Metopio. So they're in our strategic directive categories that are set by our Board of Health. So again, anything is customizable to what's going to work for you and your community.
Right. And I think that's really key because if you choose from the Metopio library, one of the best things is you don't have to worry about those Metopio topics will be automatically updated. So you can really focus your concentration on your local data. We don't do small area estimates on the fly. That's not part of the atlas, but we do have data down to the census tract. And I think it's just one of those education pieces with your public is I always say not all data is created equal. Some of it is only at the county level. Like you can do some of that math to get more granular. But some topics are available down to the census tract. So you get to select and kind of choose what reflects your community the best. And the second part of that question was about multi-jurisdictional CHAs, CHAs, CHIPs. And we have several of those happening, especially in kind of some of the western rural counties where there might be anywhere from 3 to 10 counties working together to produce a report. And the best thing about Metopio is you define it by your geography. So we love collaboration. I think collaboration is just part of my soul. We want everybody to be able to come together and work together and then leverage that into their either into a collaborative report or into their own unique reports. So if you can think about having all this data together, the tool can be used across jurisdictions, but also the atlas can be defined by whatever jurisdiction you pull together. So whether that's your state that wants one, or whether it's like we do a lot of regional collaborations, like I said. So it is flexible and should reflect your efforts in your community. And the tool is a very scalable, but that flexibility, I think, is the important part because we don't want it to be cookie cutter. And as you can see, I mean, on the video, Erica and her team did just a beautiful graphics job in terms of how they wanted to present their chip. And we pulled that into the platform. And again, someone had asked about the frameworks. Again, we don't mandate a framework. So what we recommend on the atlas is that you take your CHA framework and you just reinforce that. Make those your categories on your atlas. Make the indicators from your CHA the indicators on your atlas. We find that folks really are looking to you to guide them to understand what is the topic that I should use to understand this. There are 10 ways to look at diabetes, but there's probably one that you're using that if everybody's using, you can have a similar conversation. And so that's really what we're trying to do with the atlas is support your vision in your community. And I'm going to pop in these Q&As and just see if there's anything else we have to answer here. Thanks for your patience here. Just really quick, have we had any small local health departments or very small? Well, what is the population of Madison County again?
68,000.
68,000. So yeah, so we, I think, like I said, I think we have one client right now that has 5,000 people in their county. A lot of times when we get that small, it really is beneficial from a sustainability perspective to do something regionally. And the platform's meant to scale. Like I said early on, it doesn't matter how small you are, you still need the data to do your job. So that's really what we're looking at trying to deliver. And I'll answer some of these as we get further along. And so many health departments, this used to be something you just totally outsource, and then you get the static report and you'd be done. And I think the Atlas really is meant to be that community engagement tool. It mirrors the data that you use for your assessment. It can help you share your prioritization, your programs, and it keeps it updated during those cycles. So I think for today's audiences, I mean, we can reflect on COVID in so many different ways, but when people got used to that real-time data, it really has set, and with the pace of technology, it's just set a standard that's sometimes hard to meet with limited resources. So I think, the data refresh is an important element of this atlas, but even still, some of the indicators from government they still lag a bit. So while we got used to that real-time data in COVID, that's not really an expectation from some of your community members. So those once every 5 year snapshots just really don't cut it so much anymore. Okay. Now we're getting towards the big finale and some of the big takeaways, but you have reduced some of your staff burden. And so now, how do you see yourself leveraging this infrastructure and where do you see your efforts going next?
Oh, I mean, yeah, that is again, the biggest win is that we have the time and energy to put towards the work that actually matters. And I know that it's freed up for at least my data staff. They can deep dive into issues. They can do more qualitative analysis. They can go out into the community and really, we can just as a whole become far more data driven. And, that idea of a living document, a living CHA, is something that I am 100% bought into. And I'm excited to see change over time where we really haven't been able to when you just look at snapshots every few years. And just this year, we're starting our strategic plan. So again, we're kind of starting over, pulling the data together, and it's done in 10 minutes instead of over a course of a couple months. So I'm hoping to utilize the platform to monitor outcomes in the future and really leverage that link between the health outcome data and the performance and the process program measures.
Yeah. One of the questions was, and I have to tell you, in rolling this out across the country, I think we're working in about 500 communities between our hospital collaboration and public health partners right now. The biggest pain point is collecting that data to show impact on your chip. And so, right now, we have a way to update your chip programs in real time. And our development team is working at breakneck speed to be able to get that data directly from your partner. So it's important to be thoughtful about that because garbage in, garbage out. So we want to make sure that that real-time data coming in and that collective impact is something that you feel confident in sharing. So that is definitely, that was one of the questions that came to us. And I will tell you, I get that question all the time. So I appreciate that from whoever shared that. But I mean, you've really been on a journey, Erica. And, I was talking to a leader at a local health department in rural Wisconsin just the other day, and she was commenting on how she felt like public health really never got the tech attention that it deserved. And I know from the conversations I've had with other health departments and their partners across the country is they feel the same way. And so, I want to say we just don't want to stop here. We want to continue to hear from you and innovate with you. And I just really, really appreciate your willingness to provide clear feedback. Erica is great. And I think one of the things I love about public health is that you're not shy to say, hey, this is what I need. This is what I'm experiencing, because that is what really helps us all dream big together. And it's what really gets us excited. So I have a couple more things to share, but let me just check in on our questions right now. Okay. I see that Madison County comment. Let me get back to you on that in terms of the atlas. We'll make sure that that is resolved. Somebody put it linked in there. Just make sure that works. And then let's look at the questions. Let's see, our counties. So some of this is a little bit about the NACCHO partnership. So I'll do that. Let me just see. So, will you touch on this just a little bit before we go to the next one, Erica, just about your arrangement with your partner? So it works, I will say it works different everywhere. Metopio has brought together a package for NACCHO members that reflects your populations. Like I said, we want everyone, big and small, to be able to access the platform. And we know that it needs to be sustainable. And so the package we've made available is you get a discount if you sign up for 3 years. And also, in your instance, Erica, everybody came to the table and helped chip in to make sure that you could use this on an ongoing basis. So do you just want to touch on that a little bit?
Yeah, so um, our hospital systems, we did all agree to chip in for the next 5 years, the duration of our chip cycle. And I think the added bonus for them is in 2 years when they have to do a health assessment again, that they're going to have access to this amazing platform. Not that we won't collaborate with them, but it will just be a resource that they have. Um, and again, we are splitting 3 ways.
Yeah. Yeah, and I mean, this is one part of the work, but once as you've seen all the different ways that Erica has leveraged it across her partners, it really does lift, the rising tide lifts all boats. Um, so, as Erica shared today, when you start down the path of innovation and you start working differently, it really opens up opportunities. And we hope this presentation has really helped you take maybe a step back and look ahead and maybe ask yourself, where is that burnout? Where can you reduce some of the burden on your team or on your partners? And what intelligence is at your fingertips? If you're drowning in spreadsheets, which ones really matter? Which ones can you pull together so that you can use over and over again? Who needs to be on this journey with you? That's really important in this day and age of sustainability and collaboration, reducing duplication, and how can you parlay all these reports into real-time value? So in my mind, innovation really becomes operational when your systems support it. And I think the team at Madison County is a perfect example of that, is when you brought this together, there's just so many ways that it has increased in your ability to work collaboratively and efficiently in the platform or in the community. And so just really quick, while we're talking about innovation, is we're really always trying to fill gaps. And so I've said this a couple times, but at the pace of technology and the demands that you have on public health, we really have to figure out how to make our resources go farther without burning through our teams. And so some of the ways that Metopio we're looking to do this is to increase your ability to collect data around your programs. And with your partners, what we're showing on the screen is having that real-time roll up so that you can roll up and report to grant funders, to government entities, to partners, what is the impact you're having in any specific area? This example is around maternal health across the state of Wisconsin. Like, what does that look like? What programs are out there? How can we maximize that? And then also to collect that data from your partners so you can have real-time reporting and demonstrate collective impact. And in one county we work with, I love this story. So if you've heard me tell it, I'm sorry, but it's my favorite one. The community health, the local health department really wanted to work on reducing opioid mortality, which is a statistic that doesn't move very fast. At least if you have that lagging statistic. And they didn't have folks to be out in the community, deploying Narcan or naloxone. And so they did, though, have the capacity to train community organizations. So in their community, it's not right for every community, but for their community, they partnered with law enforcement because their law enforcement was showing up and, facing these situations and really not knowing what to do and having to wait for first responders, et cetera. So they trained law enforcement. And then as a response to that, law enforcement said that they once a month would give them how many lives they've saved by deploying Narcan. And so that became how the health department measured their contribution and the collective impact to the community, which is super powerful. So we know it's, data, 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 data. It really is data, and how to make that a part of your process across the department, regardless of whether you're the epi or you're the health director, right? And we didn't even really touch on data disappearance in this conversation. We have before in our NACCHO conversations in the landscape around data today. But I will tell you, it's on our mind constantly. And, Erica mentioned that they had already started their survey when they started working with Metopio, and we were able to get it loaded. And I think what really excites me about this, and what we've been working with health departments across the country about, is can you create your own longitudinal data? Like, it excites me because, Erica, next time you do your survey, now you're going to have 2 years worth of data, and then you're going to have 3 years worth of data, and you're not solely dependent on government entities to provide this. So we are really hoping to make surveys easier, whether you're bringing them into Metopio or you're launching them out of Metopio, as one of the ways that we're trying to fill gaps. And the other way is through that constant outreach and partnership. So just yesterday, we announced an exciting partnership with PopHive. So through this partnership, PopHive data will be integrated into the Metopio platform, enabling local health and public health leaders to combine this high quality, very timely data around chronic disease like obesity and diabetes, and timely data around infectious diseases like flu and RSV with their own community context to make those informed decisions and improve health outcomes. So this is a really exciting development, and is one of the ways that we're trying to keep our eyes out and bring you things that can help you do your job better. So if this interests you, we'll be talking with Ann Zink, who is the former Alaska State Health Director, and her team at PopHive, about how to leverage this data in your day-to-day work in a webinar on April 9th. So we'll put that link in the chat for anybody who's interested. It's just interesting to stay abreast of what are the new developments, what is available, and how you can use it. And then finally, along the lines of supporting your FAB accreditation and that continuous improvement cycle, we've developed a performance management module. And like other tools, the purpose is to help you develop, track, and report on your progress and your priorities in a really efficient and effective way. So as part of our partnership with NACCHO, we want to be sure that we're meeting your needs. And to that end, we'd like to invite you to join us to help shape the future of these assessment and performance tools. So I've got a QR code up there. If you want to join us on March 18th to share your challenges, we can innovate together. And I think Erica can attest we're open to all feedback, good, bad, and otherwise, because it helps us get better and deliver for NACCHO and for all the local health departments that we work with to really, I mean, we value the work that you're out there doing every single day. So if you are interested in innovating with us, we'd love to have you join that focus group. And I'm going to, Jenny, I have a few minutes. I'm going to just look through the questions. I don't know if there's anything, Erica, you or Jenny want to add, but let me scroll through these real quick and see if we can take any of these. There's an interesting comment about county health rankings, and they are winding down their efforts nationally, and almost all of that data we have from the same federal sources curated in Metopio, which is why I think we wanted to partner with NACCHO so that you would still have access to that. We have put the packages together. Hopefully, everybody can access and afford them. We haven't had a conversation with NACCHO about a national atlas, but we are open to ideas of ways that we can extend our partnership with NACCHO to help you all. So I'd be interested in any thoughts that you had around that. Amanda missed, can we connect to EHR systems? So really quick, Amanda, we curate de-identified and aggregated data. And so we are a HIPAA compliant company, and you can upload claims and utilization data, other data sources, surveys, surveillance, your data into the system, but it has to be de-identified and aggregated. We are a HIPAA compliant company and have a way to help you look at line level data, but that's not data we want you to share with the community, right? So we make sure that all those systems are in place. And if you missed it, that's where I think the magic happens. If you can really have some of those preventable hospitalizations and put it with your community context, then you're going to get some really deep insights for how you can plan together in your community. Let's see. Sorry, I'm scrolling through these. The NACCHO partnership is there's a discount just off of our list price, and we offer discounts to sign 3 and 5 year agreements. So a lot of times what we'll do is, I think, Erica, you said you're on a 5-year term. We really try to find that sustainable funding for the length of your CHA and your CHIP, because that's going to be your infrastructure that underpins all your reporting. And if you can imagine, if that's all in one system, how much easier your next cycle is going to be. So we want it to be that continuous improvement. So we do work often with folks. Some people can't commit, some government entities don't allow that. Just depending on what your structure is, we're very flexible and can work across all of those.
And Angie,
Yeah.
I should have jumped in to say that, the first year at least our department did pay through a grant, our portion, and then we were able to get it into our annual budget in the following year, and that will be sustained through budgeting processes.
Yes, and somebody asked why the price points aren't just on the website if they're already agreed to. It's because we look at, and somebody asked, how does governance happen when there's collaboratives? So every community is unique. So we just want to have the opportunity to learn about your population. Do you want all of the functionality that the platform has to offer? What does your funding strategy look like? Who do we need to bring to the table? And so we really want to meet your needs. We are open to talking to you about what you need to do your job, and have brought this through the NACCHO partnership to do just that. So that's every community is unique. And so you might look at that and not understand that there might be other ways that you can fit this into your budget, grow it over time. As I mentioned already before, Allen County is my favorite example because they just started with the Atlas. And then they added the CHA and the CHIP because people thought it was so incredibly helpful. So we really do want to meet you where you're at and help you with your most immediate needs, and also leverage the package that we've put together for NACCHO. All right. Jenny, we're almost at time. Is there anything you want to add? We will be sharing a copy of the slides. Jenny will touch on that. I will just say there is a question about partnering with hospital systems. And yes, so the platform is built for collaboration. Everyone needs to have an instance of Metopio in order to collaborate. And the reason for that is because you have data that you don't want to share with each other. Hospitals are not going to put data on a platform that is shared with another hospital. And so the way we're structured is everybody has their own instance. You are responsible and you have access to your data and you decide what to share. And that's super important in this environment. As you know, when you work with your hospital and other partners, this is just not data that we can throw in a pile and sort out later. And so we are built to make sure that those collaborations work. And I think we do it better than anybody else, that we have them all over the country. So very open and willing to talk to you about what that looks like. Okay. I think, let me see if there's one last question here. Uh, a really interesting question to wrap up here is, does Metopia offer daily reports or digests that can be provided to colleagues who are not able to attend frequently to a dashboard? Yes. All of the visualizations that you create can be automatically updated. So a lot of times what happens is you can embed these on your own website. You can share a dashboard and it can just update. And so folks who are following along every time they go to it, they see the update. So this is really meant to be that iterative process with a single link that somebody can go and look at your progress you're making or share in the information that you've created in a real-time sense. And so, again, it's meant to decrease the burden of having to update a report and what version you're on. If you're sharing a dynamic link and everybody knows that's going to be updated with the most recent data, they can visit it at any time. And whether that's on your atlas or you've just created it on Metopio and shared it, you can make it a public link. So those folks who need to go and check it out, they can go and check it out as well. So it's another cool feature and functionality of the Metopio platform. So with that, I really, Erica, I know that you did a lot of reflection and preparation for this, and I hope you're as proud as I am of all the work and how far you've come. You guys have done just an amazing job, and I know you'll continue to innovate and shift and grow your capacity at the Madison County Public Health Department. That darn full moon is getting me as I'm getting to time. And we're just so thankful for the partnership, Jenny, with NACCHO, allowing us to serve all the people on the front line with resources that maybe they might not get otherwise is just really rewarding for me and my team. So with that, I'll turn it back to you and see if you have any wrap-up comments for us.
Oh, thank you, Angie and Erica.
Oh, I can't hear you.
Sorry, can you hear me now?
A little better.
Sorry. Thank you both, Erica and Angie, for a fabulous presentation. Super interesting and informative. And before we close, I want to thank everybody who joined us today in the audience, and especially Metopio, our diamond level affiliate business partnership. A reminder, the webinar recording and the deck slides will be available to all registrants by the end of the week. Thank you, everyone.
Thanks so much.
Bye-bye.
Thank you.